So in the past 20 years, prescription for opioids has tripled for patients with chronic pain. And a key reason that for this is because providers are often incentivized to treat chronic pain with long-term opioid therapy. And while this does actually tend to benefit satisfaction scores in the short term, in the long term, the relationship between satisfaction and opioid therapy is a little bit more complex. And it's complex in that patients with chronic pain who receive long-term opioid prescription tend to feel discriminated against by their providers and express actually lower levels of satisfaction long-term. Now, satisfaction is an important variable to look at with this population in particular because patients with chronic pain tend to have the lowest satisfaction of chronic diseases. They tend to feel that they did not receive sufficient care and that they did not communicate with their provider well. And one of the big reasons for this is because they feel misunderstood. And so we wanted to study whether or not communication might be a stronger predictor than opioid use. And so common sense communication is a method in which providers and patients talk about the causes, duration, and treatment of pain. And so we wanted to see if common sense communication, so establishing that agreement with providers, would actually better predict satisfaction among patients with chronic pain. So we sampled a sample of 992 patients with chronic pain using what's called a dominance analysis, which basically establishes which between two different predictors, which more uniquely predicts more unique variants in two different using two different predictors, which one is a stronger predictor of outcomes. And we found that 32% of the variance in satisfaction scores was predicted by communication variables. And so we found that across outcomes, I won't talk about perceived discrimination and trust too much, but those were the other outcomes. Communication was a much stronger predictor, whereas opioid use was not as straightforward. Opioid use in general had no relationship with satisfaction, and opioid misuse actually had a negative relationship with satisfaction. And so the reason that this is a really valuable study is that providers have been told in the face of the opioid epidemic that opioids should not be treated with, or chronic pain should not be treated with opioids, but rather